In the Desafio Project, well, it started with a dream, in fact, of Marlene Temmerman. So she wanted to do something about the HIV epidemic, especially in the Tete province in Mozambique. But you want to do that in the framework of a inter-university collaboration. And then, of course, you have to find a strong partner in the country. And she started, in fact, with UGhent as the academic partner.
As you can imagine, UGhent is the oldest and the most important university in Mozambique. We have a lot of partnership with the national institution, but also with international institutions. We have projects funded by Desafio, as we are talking about Desafio now. I think that this kind of project is too important for our university.
So the general aim is to strengthen the capacities of that local partner to deal, in fact, with the multidisciplinary approach to tackle HIV in Mozambique.
We had two objectives. One is academic objective, to strengthen UGhent as a developmental actor in the field of reproductive health and HIV/AIDS. And then the developmental objective, which is to contribute to the improvement of reproductive health in the Mozambican society, also in the fight against HIV/AIDS.
This shows how the Desafio contribute just looking for UGhent, but also for the country as a whole, because it started to train people in areas that our countries need more people with knowledge, with experience, so that they can contribute on those issues.
We had 2 phases of 5 years each, and it's a multidisciplinary program. It involves different faculties, both here and in the Flemish side. And we had 7 projects in the first phase and 6 projects in second phase.
Most of the human rights capacity was coming from abroad the country, because there was no one in Mozambique who had that knowledge in regards to human rights. And then we thought that's opportunity through this project to provide local capacity, local competence and local knowledge. We have made 4 human rights journals. We think that that's a big achievement for us. We have made 2 human rights conferences, and on those conferences we brought the civil society together. There was this network created between all the law faculties, and we had a better participation in the African Human Rights Competition. And as you can see, also the library. This space before was empty, but now because of the project, most of the books which are in this library, they are supported by this program. Other achievement, it was the Human Rights Masters program.
Doing this Masters, it was a great chance for me as a student, because I had the opportunity to learn in deep about the human rights.
At this moment, I'm a human rights commissioner at Mozambican Bar Association. The knowledge that I'm implementing now, I've learned in this course.
We have more students, more academic staff interested in research in human rights. And also in the region, when the discussion of HIV, women's rights, human rights, we are also the reference.
No início do projeto, portanto, fizemos formações. Depois dessas formações, entramos num processo de reforma curricular, em que foi proposta a introdução das disciplinas de segurança social a nível da licenciatura e também de um mestrado em Direito da Segurança Social. Decidiu-se, na segunda fase do programa Desafio, criar o Centro de Estudo de Direitos Sociais, que é para continuar a fazer todas as atividades que eram feitas pelo P2, mas já integrados na estrutura da faculdade. O sonho principal do P2 era criar um conjunto de especialistas aqui na faculdade. Este grupo, portanto, está a fazer um trabalho de revisão de toda a legislação da HIV/SIDA em Moçambique e trabalhamos também muito de perto, tanto com a Assembleia da República, através da Comissão dos Assuntos Sociais e Higiene.
Our exchanges with Belgian staff influenced us in organization, how to plan things, how to look at things, how to set up things. Along these years, we have had workshops, seminars. We invited academic institutions from within the country, but also from outside. We had our scholars publish papers. We set up a master's program in anthropology. We have trained masters, but we have also trained PhD. And that is something that will be with us forever. Because through those people who are trained, they will train more people.
My experience in Ghent was really amazing. I love the city. It's a beautiful city. I love the University of Ghent. And the learning process was really good, the support of the university. And I've just finished today my PhD dissertation on communication strategies of adolescent sexual and reproductive health programs in Mozambique, the cultural challenges of Programa Geração Bis. I'm really happy because this is not the ending. From now on, I can plan to carry on research on sexuality, on gender, and plan for my postdoc.
We did quite some extension work with communities. An interesting initiative that I would like to mention was that carried out by Professor Esmeralda. She tried to merge traditional and biomedicine.
The methodology I used was participatory research that could be an opportunity for us to do research that it's also comprise the extension. We have to find a way to train the healers in health issues as well the medical doctors. They need to know more the cultural and social perspective, and this could be possible by interacting with the healers.
Before was a project that was specifically focusing on the health aspects with the Faculty of Medicine at UGhent, and our overall goal was basically to assist in strengthening the capacity within the Faculty of Medicine with respect to research in the field of sexual and reproductive health.
And in terms of capacity building and research, it was to create platforms within UGhent that could lead research in reproductive health and HIV. And then in terms of extension was to link with the communities and all the beneficiaries from our activities so that they knew what we were doing, but also that the results are fed back into their lives. In terms of training, it was really to create opportunities through scholarships for people to do their masters and PhDs.
My topic is addressing intimate partner violence, implications for medical curriculum in Mozambique. One thing that I'm really excited about, there is a plan for my online module to be integrated in the curriculum of medical schools at this year at the UGhent. And then I'll do the same to see if the other faculties of medicine, the 4 faculties of medicine can do the same for 6-year students.
We have people who were trained by us who are now taking up very important positions at the Ministry of Health. For example, the current program manager for HIV in Mozambique is a scholar from Desafio. One of our PhD students as well, she's now the National Director for Public Health. And she's bringing a lot of her inputs into the public health program of the country. I think it's a great game that has impacted at national level, but will impact at global level eventually.
So the role of P5 as a capacity building project is to supervise and monitor the other activities within Desafio. So for that we have 4 pillars mainly. The first one on academic English, the second one on teaching, improving teaching capacity, the third one on research, and the fourth one on improving the management of postgraduate studies. And what we did was to organize short training sessions for UGhent staff, how to conduct research in terms of research methods, in terms of publications, statistics, all those kind of training short courses that the staff members need to improve their research capacity. We can see, and I think it's a contribution from Desafio, that lots of publications have come out in the last few years. Really, UGhent is working on its vision of being a research-based university.
Our program was one of the transversal components. We aim at providing necessary support and tools in terms of statistical data analysis to other researchers in the project, but also at UGhent in general. First one will be biostatistics. Second will be econometrics. We also have applied statistics to social science and marketing research. The joint research projects that we conducted with colleagues from other programs helped somehow the decision-making process, especially for our main stakeholder, the Ministry of Health of Mozambique.
Well, there have always been ties with Belgium, but they were very, very, well, small and rather linked to personal relationship between some academics. What you could say now is there is an institutional collaboration, and we hope that that institutional collaboration will still, in fact, go on after the project finishes.